Welcome to the debate. Our focus today is on one of the most intriguing and really rapidly evolving frontiers in veterinary science, canine dysfunctional behavior, or CDB.
And this is such a complex topic. It really forces us to re-examine how we categorize and treat unusual behaviors in dogs, especially as we start drawing these, parallels to human neurological conditions.
Exactly. I mean, for years, these dogs were just labeled difficult or badly behaved, but now the science is suggesting something much deeper. So the core question for us today is this. Given all the emerging genetic and biological findings, should we prioritize the evidence that establishes CDB as a distinct neurological autism-like condition? Or do we have to maintain that CDB is fundamentally a descriptive, behavioral umbrella term that's used mainly for symptom management in a clinical setting?
See, I come at it from a different angle. I'm going to argue that despite the genuinely exciting genetic findings, and they are exciting, the current reality of veterinary practice confirms that CDB is, and really must remain, a collection of observed, autism-like behaviors that require very careful differential diagnosis. It's a pragmatic, clinical classification first and foremost.
And I'll be arguing that the compelling biological evidence we have now, evidence that, crosses species lines, justifies viewing CDB as a specific, genetically based neurological condition, something akin to autism that reflects a fundamental difference in how the dog's brain is wired.
Position statements. Okay, so we really have to move past this idea that CDB is just a matter of poor training or some funny habits. It reflects a core difference in how a dog's brain processes information, especially social information. And this shift in understanding is being driven by some really hard science. For instance, studies have focused on the SHANK3 gene. Now, for listeners, the SHANK3 gene is a critical piece of the puzzle in human autism because it's involved in building the scaffolding and connections, the synapses between neurons. When that gene is altered, the brain structure itself changes, and that affects social processing. That's a strong mechanism, I agree.
And when scientists looked at this exact gene in dogs, the findings were just remarkable. Beagles with a specific change in SHANK3 showed clear behavioral deficits. I'm talking difficulty processing faces and an active avoidance of eye contact, which is, that's a perfect parallel to social difficulties we see in humans. And maybe even more critically, studies on bull terriers who show that intense compulsive tail chasing, one of the key behaviors linked to CDB, found that these dogs had high levels of specific neurochemicals in their blood. And guess what? These are the same chemicals found elevated in humans with autism. This isn't anecdotal. This is strong biological evidence confirming that an autism-like condition exists naturally, that it's rooted in genetics and physiology. The condition is in their genes, not just in their training history.
I see exactly why you're emphasizing the genetic evidence. It points toward an underlying etiology, the why of the condition. But the current reality of veterinary medicine confirms that vets do not formally diagnose autism. They can't. We just don't have a simple, single, universally recognized biological marker for it yet. Instead, canine dysfunctional behavior, or CDU, functions as this essential umbrella term. It's used to describe a consistent collection of patterns, things like social difficulties, communication challenges, and these repetitive actions like tail chasing or self-mutilation that remind us of human autism traits.
But that sounds like you're just describing the problem without acknowledging the root cause.
Not at all. It means the diagnostic process for CDB is founded on symptom classification and, most critically, on differential diagnosis. That means the vet has to systematically exclude every other possible health issue first. Before that CDB label gets applied, a vet needs to rule out things like a painful knee causing repetitive licking, or general anxiety, or even early-onset dementia, neurological tumors, or a thyroid imbalance. All of these can cause strange autism-like behaviors. So the primary utility of the term CDB, really, is pragmatic. It helps owners implement immediate, effective management strategies. Focus on routines, safe environments, positive reinforcement, but only after every other medical issue has been eliminated. The term is a descriptive roadmap for management, not a definitive diagnosis of a single cause.
Okay, I appreciate the necessity of differential diagnosis in the clinic. You absolutely have to rule out pain or systemic disease. But But how can we justify treating this as just a behavioral umbrella term when we have concrete biological evidence linking it across species? Let's go back to that genetic evidence. The altered SHANK3 in beagles affecting face processing, the high neurochemicals in tail-chasing bull terriers. These strongly suggest the behaviors are symptoms of a core neurological difference, not just habits. Aren't we misleading owners and, frankly, slowing research if we insist the term is only descriptive? We have to acknowledge that the condition is, biologically in their wiring.
That's a compelling point, and I'll fully grant you that genetics likely load the gun. I mean, if a dog has an altered SHANK3 gene, it might mean their capacity for social learning, maybe something related to mirror neurons, which help a dog learn cues from its mother, is impaired from day one. That's the etiology, the biological root. However, we have to separate the etiology from the clinical definition. The current diagnosis relies entirely on observed behavior in those three categories: social interaction, communication, and repetitive actions. And if the vet has to perform a full checkup, including blood tests for thyroid issues, and rely heavily on the owner's behavioral diaries just to exclude other sicknesses, then the diagnosis is fundamentally descriptive of the symptoms. The CDB term helps vets manage that incredible complexity of the differential diagnosis, that whole process of elimination. It does not currently define a single simple neurological condition you can test for with a swab.
But doesn't this focus on a clinical necessity kind of obscure the greater scientific truth here? I mean, the source material highlights that both people and dogs process social information using homologous parts of the brain. So when those parts are affected by a genetic alteration like SHANK3, the behavior we see is a physical manifestation of that altered wiring. We're seeing a neurological disorder, not a complex behavioral problem that just happens to mimic one.
And that brings us to the precision in language, which is absolutely crucial for ethical veterinary care. The source material is very clear about this. CDB is explicitly defined as not one single sickness. It's a heterogeneous collection of patterns. So doesn't referring to it casually as a specific autism-like condition risk losing the conceptual clarity that's needed for that rigorous differential diagnosis?
If we immediately jump to autism-like, we might soften the necessity of ruling out, say, early-stage cognitive decline or generalized anxiety disorder, both of which require totally distinct treatments.
We have to differentiate a set of shared behavioral traits from a specific, defined single cause. If we muddy those waters, we risk missing the real medical problem.
I'm just not convinced by that line of reasoning, because the source material explicitly connects the social struggles not just to behavior, but to how they are wired, and it identifies that shared brain architecture. The identification of altered genes and shared neurochemical markers across species is exactly what justifies the descriptor autism-like. It transforms the concept from just mere observation, oh, this dog is strange, to a testable biological hypothesis. More importantly, for the owner, this framing provides immense compassion. It shifts the perception of their pet from disobedient or willfully stubborn to a dog that's dealing with a neurological challenge, which is a significant practical outcome of acknowledging the biological roots.
Compassion is vital, I agree, but effective intervention requires focus on what we can actually control right now. Let's look at the practical impact on day-to-day care. I mean, even if we agree on the potential genetic root, the overwhelming majority of successful management strategies are still behavioral and environmental.
I acknowledge the absolute importance of management, the predictable routine, positive reinforcement, safe spaces. That is the immediate win for the dog and the owner, no question. But insisting on recognizing the genetic root is crucial for the future advancement of care. Ongoing studies are looking at all the genes involved, and they're seeking new treatments that move beyond just behavioral modification.
Such as what?
Well, such as looking at targeted therapies, maybe tailored supplements, or specific pharmacological interventions that are adapted from human research, things that might modulate those neurochemical imbalances we see in bull terriers. These advancements are only possible if we acknowledge the biological reality that this is a neurological condition with a mechanism we can eventually target, not just some behavioral quirk we can manage with a calming vest.
That is a compelling argument for research funding and, for future hope. But we have to focus on the reality of the clinic today. Have you considered that regardless of whether CDB is caused by SHANK3 or 20 other genes, the current management strategy for the owner is entirely behavioral? The advice remains constant: environment modification, a quiet home, predictable schedules, calming aids, and strict avoidance of negative punishment. Until we have a simple, affordable genetic test that a general practitioner can give a puppy to definitively say, yes, this dog has this specific condition, the most important step is still that meticulous process of ruling out pain, tracking behavior in a diary, and consulting with a veterinary behavior expert. The descriptive, practical definition of CDB is what empowers owners to cope and manage successfully today.
But that pragmatic approach often risks missing the deeper truth. If the behavior is rooted in altered neurological wiring, we should label it that way. That opens the door for treatments that correct the underlying mechanism, not just mitigate the external effect. Why wait years to refine the definition? The science already justifies the shift.
Because the veterinary oath requires us to treat the whole patient. If a dog is in pain and we skip that crucial step of differential diagnosis because we've prematurely slapped an autism-like label on their repetitive behavior, then we have failed that patient. The descriptive umbrella term forces the rigor necessary to ensure no stone is left unturned medically.
So I think we've established that compelling biological and genetic evidence, including structural differences from the SHANK3 gene in beagles and specific neurochemical markers shared with humans in breeds like bull terriers, strongly supports the existence of an autism-like neurological condition in dogs. Recognizing this biological foundation is essential for advancing research, for transforming our understanding of dog minds, and ultimately for finding tailored etiological treatments rather than simply relying on symptomatic management.
And while those genetic findings are undeniably exciting and absolutely critical for future research, the practical reality of veterinary care dictates that canine dysfunctional behavior currently remains an essential umbrella term. Its proper diagnosis depends heavily on that rigorous process of differential diagnosis, ruling out other medical conditions like thyroid problems or pain, and its successful management relies entirely on implementing strict behavioral interventions and environmental stability. The term's real utility lies in its descriptive power within the clinic today.
The exploration of CDB really requires both a meticulous scientific approach to genetics, seeking that biological root, and a compassionate, precise behavioral framework for supporting these unique animals.
Which perfectly illustrates how focusing on different levels of analysis, the microscopic mechanism versus the macroscopic clinical reality, can deepen our understanding of this challenging and complex topic that's presented in the source material.